Do it for the gram.
Do it for the clips. Now, hold on. Hold on. I got two things going. Trying to get baby. Put on that.
Oh.
Breathe. Breathe. How long you going for? Breathe.
Oh my Lord. Maybe maybe 5 minutes? Okay.
Throw some more sleep.
Okay. Wow. It has been a while since we've been here. Actually, I don't know if it's warmer in here than it is in the fresh air right now. We do not know what the actual temperature is because Lucille, our faithful friend, she went from a cold plunge recorder to a baby bath water temp reader, and then since has transitioned to a very lovable bath toy. So we are unsure the temperature of the water, but we do know that the temperature of the air is somewhere in the 30s in South Louisiana because it is snowing. This is the first time that it has snowed in Louisiana since 2017, I believe. So it has been a little while. Also, it has been some time since we have gotten, getting the neck a little lower, gotten together for a Hot Topics cold plunge. Now, I am going to come at you with a very hot topic in the realm of physical therapy and fitness. And it is not something that I talk on often, but it is a very strong stance of mine. And this is guilt shaming healthcare providers when it comes to high intensity fitness regimens, programs, more specifically things like CrossFit. And I bring this up as a topic. So did not immediately melt, which means this water is very cold. So a topic. Oh my gosh, can you hear it?
It's like bubbling.
Okay, so in all seriousness, a topic that is very near and dear to me as an avid fitness enthusiast, someone that does participate in CrossFit and high intensity type training, that I find providers that try to scare or shame the patients and clients that come to see them out of these type of exercises and tell them that those type of fitness practices are what caused them to be the way they are, or will significantly hurt them or paralyze them, or make their condition significantly worse if they return to those activities. And I bring this up because I recently worked with a client that had been out of the gym for some time. And when I mean some time, a year. So some time. Have been out of the gym for a year because of a car accident that they had been in. When they started seeing this particular provider, the provider used terminology that scared the patient. Like, this is the worst image I've ever seen, and I can't believe you're doing that type of exercise. You could really hurt yourself. But then continue to treat this client for a year, seeing them in and out of their particular practice setting time after time after time without ever referring them to any sort of advanced provider or advanced practice. And as a physical therapist, this is concerning. This is a red flag because we know within our scope of practice and our wheelhouse as direct access care providers, and sometimes the first provider that will see a patient or a client after an injury, we know when a condition is that bad or the worst we've ever seen, or puts them at significant risk for additional injury or future injury if they return to activities like exercise, we know that that big red flag means we need to send that up the chain. There is a likelihood that this patient needs to go see and possibly a neurologist or a neurosurgeon, or maybe it needs to be sent directly to the emergency department if they are that bad that they can't engage in certain types of activities. And so I just really hate that providers will come in and they instantly hear the name of some sort of challenging type activity like CrossFit or HIIT training, and they immediately tell the person that is what caused them to have this worst imaging they've ever seen before. When in reality, after taking a deeper dive with this particular client, I learned that the client had, obviously was a little bit older in age, and so had some years on her particular body. Also, had been exercising for several years, was in a car accident, and then also had a history of horseback riding as well. So we have all these other factors to consider outside of CrossFit alone to potentially be the reason why the patient had positive findings on her imaging. When meeting with this client, she came to me because she was trying to get back into the gym because she missed the gym. She tried doing some other lower intensity type exercises, but didn't find that passion like she had for CrossFit. And when I asked her how her transition back to the gym had been, it had been a week so far, she disclosed that she had some fear about activity and was scared about being back in the gym because of what this provider had said to her. And this, just breaks my heart because a person like this, first of all, should never have spent a year out of the gym for the type of injury that they had and the type of condition that their imaging showed. And second of all, the person should have really been supported by the provider that they went to go see to help her get back into the thing that she loved doing. It's fine if providers are not HIIT training or doing CrossFit or the tactical games or these other high intensity strenuous activities. That's okay. It doesn't necessarily mean that you can't go to that provider, but if a provider takes their opinions and their thoughts on specific type training and pushes that on you without educating you or providing you with facts or research to support that, then really they're actually doing a disservice to their patients and their clients. And so I bring this up because this is an extremely hot topic that pops up all the time in the fitness industry. And as a physical therapist, I see other physical therapists that are doing the same thing to their patients and clients and guilting them out of the type of exercise and the fitness that they love. I completely understand that there are certain types of things that can cause injuries, and CrossFit is a type of functional fitness that can cause injuries. But guess what? There's so many other things that can cause injuries too. You can get injuries in your group fitness class. You can get injuries swimming and training for a triathlon. You can get injuries doing Zumba or some other type of Pilates. There are plenty of ways for you to be injured, especially if your body has limitations already. That's why I think it's best for individuals to align themselves with providers that, first of all, understand the physical demands that are required for different sports and different activities. We call it a needs analysis. Your provider needs to have done a needs analysis on the type of goals and training that you want to do so they can help you see where your limitations are and truly if the pain you're having is being caused by the activity that you're doing or some other type of lifestyle factor like your weight, like a motor vehicle accident, like your age, like your posture, like your job duties, like your sleeping position. All of those things can factor into an injury and can cause you to have an injury while you're performing your activity, but it may not necessarily be your activity that's the quote unquote bad thing for you. So I recommend that you find somebody that does that needs analysis. I also highly recommend that you find a provider that cares about your goals and doesn't push their opinions and their thoughts on you. There are so many providers out there, physicians, physical therapists, that will support your goals that you have. You just have to find the right one. So, from the plunge, hot topics, do not align yourself with a provider that shames you or make you feel guilty for doing exercises and fitness that you love. And with that, we are coming up on our 10-minute mark from the plunge. And yeah, this has been fun and it's been a cold one.